These are the guidelines that all physicians are following nowadays. They have been established for at least the past 3 years. And I'm gonna go walk you through it, through this table. It looks complicated. It's gonna be very simple the way I'm gonna show you. So the first thing we're gonna look at this in columns. We're gonna go here. The first column is gonna be the category of blood pressure, how we're gonna label it depending on your severity. The second column here is the systolic blood pressure, or the top number. We're gonna see if either or, and or. And here, the last column, I'm gonna be talking about the diastolic blood pressure or the bottom number. And then I'm gonna start looking at into rows. The first row here, the green row, I'm gonna see if the blood pressure is normal. The patient needs to have a systolic or top number less than 120 and a bottom number less than 80. If you are there, if you take your blood pressure and you are there, you know that your blood pressure is normal. That's where we all wanna be, if possible, throughout our lives. The second stage is elevated. And this is where things change between yellow and orange. This is where things start to change for the new guidelines. We're gonna call this elevated blood pressure. And for this one, the top number is gonna be 120 to 129, and you're gonna have less than 80 of your diastolic blood pressure. That's important because in the past, we were a little more lenient and we would let patients go a little bit further. Right now, this is already telling us elevated blood pressure. What does that mean? That if you keep going up, you're gonna be diagnosed with hypertension or high blood pressure. And this is where the actual guidelines change. This is called stage 1 hypertension, this row here, this orange row. If you have a systolic of 130 to 139 or a diastolic of 80 to 89, once you hit 80, we're talking about that level 1 hypertension. So the bottom number is still important. In the past, we used to call this prehypertension. Anybody who had a pressure of 130 to 139 over 80 to 89, we were just observing the patient, follow lifestyle changes. We would not start this patient on blood pressure medications. However, when scientists went back to the data, they realized that those patients who were in this range of numbers, those patients in the future were at higher risk of developing stroke. So it was determined that in order to protect patients, we had to be more aggressive with treatment. So this is why people, once they hit 130 to 139 or 80 to 89, these patients will be started on blood pressure medications, of course, in addition to lifestyle changes. And the next level will be stage 2 or level 2 hypertension. This is when you hit a systolic of 140 or more, or if the bottom number is 90 or more. So now this is level 2 hypertension. We know we don't want to go there. We never want to get to the level. We always want to prevent patients from being diagnosed with hypertension. And also, if you have high blood pressure, then we don't want to progress into the next stage. So these patients in level 2 will be probably taking higher dose medications or more than one medication in order to prevent them from getting further complications. And the last stage will be hypertensive crisis. This is where we need to take the patient likely to the hospital, to the ER, go into the clinic. And this happens when your top number is greater than 80 and or a lower number greater than 120. And 120 is extremely high. If at any point you have any of these numbers, you need to go get medical attention. These patients, especially if they have symptoms, will be most likely sent to the ER, admitted to the hospital, treated with IV medications because it's not safe to just treat them with a pill, send them home. We have to be more aggressive on these patients and then gradually treat and bring these numbers down to a safer level before they can go home. So this is likely at least 48-hour admission to the hospital. So let's just be very careful. Let's prevent hypertension and let's try to avoid going into the next level.